Hi there, this is Dr. Ma'in Hasib again with lesson 2 on a specimen journey. If you recall, in lesson 1, we talked about an introduction. We talked about the journey of a specimen, pre-analytical, analytical, and post-analytical. And we talked about the possible error during the specimen journey. Okay, and in this lesson, lesson 2, we'll talk about or we'll cover what causes these errors, how to avoid or control these errors, what happens if we reduce these specimen errors, and what happens if we don't, and brief summary. So what are the causes of errors or poor quality during the specimen journey? Errors could be human, for example, lack of motivation, interest, fear, stress, shortage of staff, lack of training, okay, unqualified staff, people taking shortcuts, they're not following the procedure it should be. It could be from the machine or the instrument. Lack of capability, lack of maintenance, non-availability of spare parts, wear and tear on the instrument, improper setup calibration, outdated technology, all these things. It could be from the material, low-grade material, unspecified material, variation in the material. It could be management, lack of vision, mission, and value system, failing to identify or understand customer needs or requirements, short-term planning, inadequate poor planning, flawed incentives and indicators, favorism, lack of supervision or monitoring, attitude toward change, lack of decision-making and communication skills, lack of process understanding, lack of fact-based decision-making. It could be the method that we are using, like lack of procedure not followed, conflicting requirements, procedure not communicated, too rigid or too relaxed requirements. It could be the environment, like temperature, humidity, lighting, etc. So these are some of the things that could cause the errors or poor quality during the specimen journey. Now, how do you avoid or control these errors? The magnitude of the effect of some of these errors on patient care is very significant. Since information provided by the clinical laboratories affect more than 70% of the clinical decisions. In other words, the doctors depend 70% of the time on a lab test in order to treat a patient. Okay? So it is very difficult to establish effective methods for monitoring and controlling pre-analytical variables because many of the variables are outside of the laboratory area, which I mentioned in lesson 1. So, therefore, it requires the coordinated effort of many individuals and hospital departments. Mostly are due to inadequate collection technique and knowledge of appropriate procedure. So it's either training or it's a training issue, whether they're not trained to collect right or they don't know the procedure. A result is no better than the quality of the specimen received in the laboratory. You give me a junk sample, I give you junk results. Simple. You give me a good sample, I give you good results. So some mechanism that help detect wrong blood in tube, for example, in patient identification, The highest frequency of error occurs with the use of handwriting labels and request forms. Okay. The use of barcode technology has significantly reduced ID problems. So use technology when you can. Historical blood grouping, for example, not matching previous laboratory testing. Delta check, a significant change in parameters that are consistent with the previous result. If you don't know what's a delta check, you need to look into it and try to implement it in your own laboratory. Diagnosis history. Current results are not consistent with the diagnosis. Doctor nurse collectors realize that they may have made a mistake and they contact the laboratory. That's how some of the errors are discovered. Doctor phones for a result on a sample that is not received yet. The doctor is certain the sample was ordered, collected from the patient. We need, in order to avoid these errors, we need to help the collectors get it right the first time. How? You need to have adequate, qualified, and experienced staff. Give them the appropriate education, training, and tools to perform the task required correctly. Use of well-written procedures and policies, specimen collection manual. Use technology, for example, use the barcode scanner for patient identification. You need to have a zero tolerance policy for errors by rejecting all samples that are compromised. You need to provide back to the collectors, whether it's a person or a group, you need to provide them with the feedback when they make errors. How? Feedback monitoring cycle. It's a 5-stage cycle that allow evidence-based feedback to drive improvement, and the monitoring of evaluation intervention put in place to improve error rates. What are the steps? You record the error, you analyze the error, you report back to the area, you formulate corrective action, and then you implement the corrective action, and then you evaluate that corrective action. If it works, that's good. If it does not work, then you need to repeat the cycle again with another corrective action maybe. Okay, and this is just a picture of the cycle with the 5 steps. How to avoid or control these errors? You need to use quality improvement indicators, KPIs, or quality indicators, as we call them in the lab. You need to use quality indicators to monitor the 3 phases of analysis, to provide feedback, training, and make suggestions for improvement. This is just an example of a table that has some indicators that you could use if you need to. For your benchmarking or goals or limits, you could get that from published studies, as one mentioned here, or other published literature, or from other labs similar to your laboratories, or you can establish your own goals or limit from data from your lab. And this is what I usually recommend. And we'll talk more about this when we talk about the subject of quality indicators. What happens if we don't reduce specimen errors? What happens? Okay. Reducing medical errors will help ensure patient safety, which reduce morbidity and mortality. Eliminate or reduce waste and repeat work or analysis, which make the lab more cost effective. It will reduce the turnaround time and wait time for patients. Okay. Ensure confidence in the lab result, which will generate credibility for the laboratory and the staff. And finally, the result of all this is consistent service testing that is safe, more reliable, more efficient, more cost effective, which will result in satisfied patient and healthcare providers. What happens if we don't reduce these errors? Unnecessary overtreatment, okay, lack of treatment, and or over investigation testing, which will cost money, time, effort, and energy. It might cause death or legal actions, or loss of credibility and reputation of the laboratory in lack of investigation, testing, or no treatment. What are we talking about? Okay, most of the errors in the lab are invisible. We don't even notice them because, like, for example, if we take two patients, okay, we mix two patients and both of them are normal. How are you going to know that you did or you reported the wrong result on the wrong patient? You won't. Usually you won't. So most of them are invisible because there's no harm done. Some of them, very rare of them, are significant. 1 out of 3,000 samples will cause a significant error for a patient. However, achieving and accepting 99% level of quality, it means accepting a 1% error rate. What does that mean? Okay. What we mean by that? In real life, we mean this. Okay. In a hospital or in healthcare, we could have this, we could have this, we could have this, or this, or this, or may God forbid this or this. Okay. Final thoughts. The pre and post analytical phases of the process accounts for 93% of errors in the laboratory. Without a good sample, any analytical effort is useless. It is impossible in medicine to eliminate errors, but it's possible to reduce them. You need to promote a culture in which the existence of error is acknowledged, yet error prevention is recognized as everyone's responsibility. It is important to monitor error to identify deficiencies and monitor success. Reducing errors not only optimize patient safety and care, but also improve efficiency and credibility of the laboratory services. You need to have a zero tolerance policy. Keep sample acceptance standard high for patient safety. Repetitive errors are not allowed when they are easily preventable. Also, largest reduction in specimen error are likely to result from interdepartmental cooperation designed to improve the quality of specimen collection, transportation, processing, and resulting. This needs total commitment from everyone to work as a true team. Doctors, nurses, technologists, phlebotomists, staff, executives, and managers are all into this together. Only and only together they can achieve improvement that none can achieve alone. Training, education, and accountability. It is important to continually educate internal and external sample collectors, giving them not only the skills but understanding of the sequences of errors. I am done with the specimen journey. Okay, for the next subject, please go to quality control in clinical laboratories from A to Z. Thank you for watching.